Have you ever gone to the doctor for just a cough? The moment you do, something pretty amazing kicks off. It's basically a detective story where your doctor is the lead investigator hunting for clues to figure out what's really going on deep inside your lungs.
So, where does this investigation even begin? Well, it starts with the one and only witness, your own body. It's sending out signals all the time. The real question is, what secrets are hiding in just a single breath? And how on earth does our detective start to uncover them? The case always opens with the most obvious pieces of evidence, those warning signals your body is sending out. Things like a cough that just won't quit, or feeling out of breath. That's the start of the trail. Think about it. These symptoms are the first clues. The doctor's whole job is to be a kind of super sleuth, looking at every single piece of evidence to figure out what your body is trying to tell them. Okay, so here is where it gets really interesting. You'd think the investigation would start with the lungs, right? Nope. Our detective actually begins by looking for clues on the outside of the body, sometimes in the most surprising places. For example, take a look at these fingertips. This is something called finger clubbing, and it can actually be a sign of a chronic lung problem. The thinking is that low oxygen in the blood messes with blood flow, causing the tissue at your fingertips to kind of swell up. A problem deep in your chest, showing up at the very tips of your fingers. How wild is that? But our detective doesn't just stop there. Oh no, they're looking for a whole pattern. Are the lips a little bluish? That's a sign of low oxygen called central cyanosis. Are there tar stains from smoking? What about swollen legs? Every single one of these is another piece of the puzzle. So, after gathering all these external clues, the detective moves in closer. It's time to get hands-on, using touch and sound to find more direct evidence from the chest itself. And this whole process usually breaks down into 4 core techniques. It kicks off with just looking, or inspection. Then it moves to feeling the chest, which is palpation. Then tapping, called percussion. And finally, listening with a stethoscope. That's auscultation. During that first step, inspection, the doctor's looking for anything unusual about the chest shape. What you see here is a condition called kyphoscoliosis. It's a curve in the spine that can literally restrict how well the lungs are able to expand and do their job. Then you've got percussion. And honestly, the best way to think about this is like sonar. Yeah, exactly. By tapping on the chest and listening to the sound that bounces back, a doctor can actually start to map out what's going on right beneath the surface. So what are they listening for? Well, a healthy lung that's full of air sounds resonant, kind of like a hollow drum. But if it's filled up with fluid, the sound totally changes. It becomes stony dull, a heavy, flat thud, like tapping on a solid wall. That tells the detective that something is blocking the air. And finally, the stethoscope comes out. Now our detective is listening to the soundtrack of your breathing. They're tuning in for what are called added sounds, like wheezes or crackles. These aren't normal at all. They're audio clues that point to things like narrowed airways or fluid rattling around in those tiny air sacs. All right, all the clues so far have been pointing in a certain direction. But to really, truly crack the case, the detective needs to see the crime scene. It's time to get a look inside the chest. And this, right here, is often the smoking gun. On the left, you've got a normal chest x-ray. Now look at the right. See all that darkness? That's a pneumothorax, a collapsed lung. The air that's supposed to be in the lung has leaked out into the chest. The fact that you can't see any of the normal lung markings, it's a dead giveaway. And here's another, even more dramatic example. That huge whiteout area on the right side, that's a massive pleural effusion, a huge buildup of fluid. It's so big, in fact, that it's physically pushing the heart and the windpipe all the way over to the other side. Just one picture, and it tells you so much. You know, visual evidence isn't just about X-rays. It can also come from, well, from what a person coughs up. The color and the texture of sputum gives even more clues. If it's frothy and pink, that might suggest fluid overload. If it's thick and nasty looking, it points right to an infection. So, the evidence is all on the table. We've got the external signs, the sounds from the exam, the pictures from inside the chest. It's finally time for our detective to put it all together and solve this mystery. Let's watch how it works for a classic case, like pneumonia. First clue, the patient has a fever. Second, the doctor taps the chest and hears that dull thud over one spot. Third, they listen with the stethoscope and hear crackles. Fourth, the visual clue. The x-ray shows a shadow. You see? All the clues point to one clear diagnosis: pneumonia. Case closed.
So, with the case solved, let's zoom in and take a closer look at the crime scene itself, this incredible, complex world inside your lungs that our detective was investigating all along. It all starts with the bronchial tree. Just think of these as the major highways for air, and they keep branching off into smaller and smaller roads and side streets, delivering air to every single corner of your lungs. It's just an incredibly efficient delivery network. But who keeps these highways clean? Well, get a load of this. This amazing image shows microscopic cilia. They are the lungs' tireless little street sweepers, constantly beating together to move mucus and all the dust and germs trapped in it up and out of your lungs. It's a self-cleaning engine, and it is working for you right now. And way at the end of all those tiny roads, you find the alveoli. You have hundreds of millions of these little air sacs. If you could spread them all out flat, they'd cover an entire tennis court. And this is where the real magic happens, that vital, life-giving trade, oxygen in, carbon dioxide out. And your body performs this magic trick, this unbelievable act of breathing about 20,000 times every single day. Most of the time, you don't even think about it. From the clues on your fingertips, to the sounds inside your chest, to the microscopic street sweepers working non-stop, there's an entire universe at work inside you. So, since you take about 20,000 breaths a day, what are you going to think about during your next one?